students. So in the last lecture we have seen about the basic introduction of the respiratory system. For learning this chapter, so let's start with the drugs acting on respiratory system. So in this first we will study about the asthma. So bronchial asthma basically. So what is this asthma? Asthma is a chronic respiratory condition where the airways in the lungs are inflamed and narrowed, causing breathlessness, then wheezing, chest tightness, and coughing. Symptoms some as a recurrent episode known as asthmatic attacks, most commonly at night or early in the morning. So these are the symptoms of the asthma. Asthma is usually diagnosed in childhood and lasts for life. There is no cure for asthma. Only prevention and taking proper medications is the option for the asthma. So, in this asthma, bronchial asthma, the lungs contain millions of air tubes or airways called bronchi and bronchioles, what we have seen in the respiratory system introduction, which bring air in and out of the body, right? These airways have a layer of smooth muscle in their wall, which enables them to constrict or dilate. In response to this body's higher demand for air, such as during exercise, the airways dilate to increase the airflow. This is in the normal condition. But in presence of the pollutants in the air, the airways constrict to prevent the lungs from being polluted. So, in people suffering from asthma, these airways are inflamed basically, also narrowed and become more sensitive to certain substances. Asthmatic attack asthmatic attack happens when the airways react to these substances. And during an attack, the smooth muscle contracts, squeezing the airways and making them even more narrower. And mucus secretion is also increased, which further obstruct the airways. And asthma is most commonly considered as an inflammatory response disease where the body's immune system over reacts to certain environmental agents. Now, let's see the causes of asthma. They are complex and not fully understood, but likely involve a combination of genetic and environmental factors. The family history is a known risk factor for the asthma. There are at least over 20 genes associated with asthma, of which many are involved in the immune system. Most people who have asthma also have allergies. Many environmental factors such as air pollution, chemicals, smoke, and allergens have been associated with the development of asthma or triggering of asthmatic attacks. Now, triggers are factors that initiate the attack basically. This can be very different from person to person, obviously. Common triggers include allergens such as pollen, animal fur, then pet dander, sulfites in preserved food, then irritants such as cigarette smoke, industrial chemicals, dust, household chemicals, medications such as aspirin, beta blockers, then also physical activities and exercises. These are all trigger factors for the asthmatic patients. Now, there is no cure for asthma as we have seen. The most effective way to manage the symptoms is to identify the triggers of asthmatic attacks and avoid them. Simple. There are two main classes of medications, bronchodilators, the substances that dilate bronchi or bronchioles. These are used as a short term relief of symptoms, and inflammation moderators such as corticosteroids are taken as long term treatments. Now, asthma inhalers are used to deliver the medication to the lungs. Inhalers are also used. The number of conditions tend to occur more frequently in people with asthma and should be taken into account when treating with asthma. So, which are those conditions like allergies such as eczema and hay fever? Then, these individuals are considered hyperallergic. they have a high tendency to develop allergic reactions, asthmatic patients. Then the combination of these conditions is known as atopy or atopic syndrome. Uh, Immunotherapy may be recommended for this group of patients. Then another criteria is gastroesophageal reflux disease, or also known as GERD, a condition in which stomach acid backs up and damages the mucosal lining of the esophagus. This GRD may worsen asthma symptoms, and medications for asthma often worsen GRD symptoms. So, this is the relation in between this. Treating GRD usually improves asthma and must be included in an asthma treatment plan. This is just extra things what we are discussing. Also, obstructive sleep apnea, or also known as OSA, that is a obstruction of the airway at the throat level during sleep. Asthmatic patients are higher risk of developing OSA. The mechanism of this association is largely unknown, and sinusitis is also one of the condition. In this inflammation of paranasal sinuses, then sinusitis commonly worsens the asthma symptoms and makes treatment less effective. So these are all related to the asthma, what we have discussed. Now let's move towards the next part. Let's start the chapter that is drugs acting on respiratory system. So drugs for bronchial asthma. Now here bronchial asthma, as we have seen, is characterized by hyperresponsiveness of tracheobronchial smooth muscle to variety of stimuli and resulting in the narrowing of air tubes, what we have learned already, and often accompanied by increased secretions of mucosal edema and mucus plugging. In this, the symptoms include of bronchial asthma is dyspnea, then wheezing, cough, and maybe the limitation of activity. These are the drugs for bronchial asthma. Some predisposing factors are there. Here, asthma is now recognized to be a primarily inflammatory condition, and inflammation underlying hyperreactivity, we all know. An allergic basis can be demonstrated in many adult and high percentage of pediatric patients are there in the asthma. In others, variety of trigger factors already we have seen, but these are some allergy, infection, pollutants, exercise, exposure to cold air, psychogenic problems already we have discussed, right? So, the drugs for bronchial asthma basically extremes depend on the extremes types of asthma. Here, extrinsic asthma, it is mostly episodic and less prone to the status asthmaticus, and the intrinsic asthma it tends to the perineal. Status asthmaticus is more common. Now, mast cells present in lungs uh, uh, and inflammatory cells recruited as a result of initial reaction produce a multitude of mediators. This is basically the drugs for bronchial asthma mechanism of action. Due to predisposing factors, what we have seen in the previous slides, in the site of asthma, there are recruitment of two types of cells. First is a mast cells and another one is a other inflammatory cells. So these cells secrete variety of mediators. Uh, in this, the first is a release of mediators stored in granules. This happens immediately. It includes histamine, protease enzymes, and TNF alpha, tumor necrosis factor alpha. Then release of phospholipids from cell membrane, followed by mediator synthesis. This happens within a minutes. Here includes PGs, that is prostaglandins, then LTs, leukotrienes, and PF. Then third is activation of genes followed by protein synthesis. This happens over hours, and here include interleukins and TNF alpha again. So these mediators together constrict bronchial smooth muscles, cause mucosal edema, hypomia, and produce viscid secretions, all resulting in a reversible airway obstruction. And then let's see about the approaches to the treatment. Now, approaches to the treatment include first prevention of antigen antibody reaction, then second neutralization of IgE. Here, omalizumab drug is there that we will study in the further slides. Then third is a suppression of inflammation and bronchial hyperreactivity. This includes the corticosteroid therapy. Then fourth is a prevention of release of mediators. Here mast cell stabilizers are useful in this. Then fifth is antagonism of released mediators. Here we will see the leukotriene antagonist, antihistamines, and PF antagonist. Then sixth is a blockade of constrictor neurotransmitter. In this class we'll see the anticholinergics. Then seventh is a mimicking dilator neurotransmitter. We can simply call it as a sympathomimetic. That also we'll see. Then the eighth one is the directly acting bronchodilators. In this we will see the methylxanthines. Some MCQs on bronchial asthma, allergic asthma and rhinitis are related to the chemokine receptor. So this is somewhat a deep level question, that's why I have given the explanation for the same and answer too. You try to first solve out the question and then have a look on the answer. Then second question for this, just read it and go through it. Then which of the following medication may be suspected as a possible cause of bronchial asthma? Already we have discussed in the introduction of bronchial asthma. The answer is also given. Then acute management of bronchial asthma include the following except the answer is a rapid infusion of dopamine. This is the next question. This also we have already discussed atopic allergy in the bronchial asthma introduction. Then this is the well known as far as microbiology is concerned. And this is the one more question. This is the another one. So these are some MCQs. If you would like to hear more MCQs, definitely will share with you.